came together today to begin this vital discussion on women's reproductive and gynecological pain. And it's recently been brought to the attention of the public and the medical establishment that there's a gap in care when it comes to managing women's pain. And we've learned that it's frequently inadequate or ignored. By participating in this forum, we're shining a light on this problem and changing the conversation. So when women complain of pain, they're taken seriously and treated properly. We're very grateful for your participation and contribution to this important discussion. It's a starting point to help us begin to work together to address the critical issue of helping women when they state that they feel pain and figure out the steps we can take to address this problem. And since I just happen to be a diligent note taker, I'm going to provide a recap of our discussion and outline some next steps. Unfortunately, I have arrows all over my piece of paper. I think one of the big things that came out of our discussion was partnership between providers and patients, and communication, and encouraging communication with the patient, between the patient and the provider, centering care on the patient, especially patients from marginalized communities, listening to the patient, believing the patient, and also we talked about normalizing young women going to gynecologists and creating a safe space for having further conversations about reproductive or gynecological procedures. We talked a lot about education, continuing education, education of healthcare providers, so that in trauma-informed pain, and so that they realize that pain is not in a woman's head, creating norms of how to talk to patients, taking time. Also, having providers be comfortable with cultural differences or with different life experiences, and ensuring that they recognize the human rights and dignity of all patients. We talked about having more options for managing discomfort, improving the capacity for pain control, and in that context, insurance coverage came up, and some of these options are not always covered by insurance, and that's something that we perhaps need to look at. Also, providing tools, whether it's transportation or childcare, tools to ensure that diverse patient populations are feeling safe, other tools like patient advocates. In terms of some of the next steps, we discussed curriculum, specifically ensuring that the next generation of medical providers have the tool to address pain in women, and then supporting research into pain disorders, creating working groups, or ensuring that current mandates are more up to date and relevant. Another thing that came up was funding support groups and patient navigators, and creating communities of women who can talk to each other and inform each other, as well as discussions, opening up the discussion to with pediatric providers to ensure, again, that there's a continuum from children, young women, into adulthood.